Good morning. We will continue with the remaining part of drug abuse and de-addiction. In the last part of the first class, we were discussing about amphetamines. So now we will continue with the remaining portions in amphetamine. So we will see the tolerance and withdrawal. Amphetamines have marked tolerance. On prolonged use, they exhibit tolerance. So if you want to get a adequate response, you should increase the dose. And it produces the abstinence syndromes like increased appetite, sleepiness, exhaustion, mental depression, and most of the time patients need to get certain antidepressants to support during the withdrawal reactions. Now we shall see certain congeners of amphetamine, which includes dimethoxymethylamphetamine, methylene dioxyamphetamine, and methylene dioxymethylamphetamine or MDMA, and it's also popularly known as ecstasy. And these chemical congeners mainly have hallucinogenic properties. This MDMA has a more selective action on the serotonin transmitters in CNS than the amphetamine. The toxicity which is associated with the overdosage of this MDMA leads to hypothermia, symptoms of serotonin syndrome, and seizures. So, for the management of this condition, we do not have any specific antidotes. We only have supportive measures. And the withdrawal reactions are more or less associated with depression. Next is cocaine. Its effects are almost similar to that of amphetamine. The euphoria, increased feeling of self-confidence, increased mental alertness, these all effects which are associated with amphetamine use, they are short lasting, but they positively reinforced its continued use. Overdosage toxicity of cocaine is manifested by arrhythmias, seizures, or respiratory depression, and all these factors may contribute to increased mortality as well as morbidity. The cardiac toxicity is partly due to the blockade of norepinephrine reuptake by the cocaine. Certain transporters which reuptake the norepinephrine to terminate its action. So, by blocking these type of transporters, we can prolong the actions of norepinephrine. Cocaine is acting like that. Cocaine inhibits the reuptake of norepinephrine, so its action is prolonged. And its local anesthetic action contributes to the production of seizure. That means it's acting by decreasing the seizure threshold. Cocaine is a powerful vasoconstrictor, so its toxicity is associated with severe hypertensive episodes and usually results in myocardial infarct as well as stroke. And as you know, cocaine does not have any specific antidote, so during its toxicity we can only give supportive treatment to the patient. And its abuse during pregnancy is associated with increased numbers of fetal morbidity as well as mortality. Then it's about the withdrawal of cocaine. The abstinence syndromes following the withdrawal of cocaine is similar to that of amphetamine, and there is severe depression is seen usually during the withdrawal, which urges the patient to restart the cocaine again. So for the management of cocaine withdrawal, most of the time along with the psychotherapy or supportive measures, antidepressant drugs are needed. And in infants, those born to mothers who abuse cocaine, there is increased risk of mortality, morbidity as well as teratogenicity. And sometimes the babies may be cocaine dependent too. The next group is hallucinogens. Example is phencyclidine, and they act by antagonizing the NMDA type of glutamate receptors, and they do not have any actions on the CNS dopaminergic pathway. As I have already said that most of the drugs they produces the dependence by acting on the dopaminergic pathway in the CNS. The psychotic reactions are common with the phencyclidine, and also there is impaired judgment as well as reckless behavior. The overdosage of phencyclidine will result in nystagmus, marked hypertension, and seizures, which could be fatal at times. Parental benzodiazepines, for example, diazepam and lorazepam, which are effective in reducing the fatality in overdosage with phencyclidine, and also they have a protective role against seizures. Next is miscellaneous hallucinogenic agents. These agents won't usually cause us dependence, but they have good abuse liability, which includes lysergic acid diethylamate, LSD, mescaline, psilocybin, and certain anti-muscarinic agents also. These hallucinogenic agents usually not acting in the dopaminergic pathway of the CNS, and as I already said, these agents do not cause any dependence. And there, the term which is used to collectively denote the CNS effect of these drugs include psychedelic action or mind revealing action. In addition to the perceptual or psychological effect, they also exhibit certain somatic problems also, which includes paresthesia, weakness, nausea, and at times they do exhibit panic reactions. Next is marijuana. It's a very famous agent for abuse. Actually, the term marijuana is a collective description for the psychoactive constituents in crude extract from the plant Cannabis sativa. The active principles in the plants include cannabinoids, which like tetrahydrocannabinol and cannabinol. Now we shall see few important points about cannabinoids. We have certain endogenous cannabinoids in our body. They are synthesized mainly in the CNS, and they are released from the postsynaptic membrane, and they act as retrograde messenger, and they goes and binds to the certain receptors on the presynaptic membrane. So they prevents the release of normal neurotransmitters like dopamine, and the function of normal neurotransmitters is not taking place. And the receptors for these endogenous compound, they are thought to be the targets for the exogenously administered cannabinoids which are present in the marijuana. Coming to the effects of cannabinoids, the CNS effects include a feeling of being high, which is associated with euphoria, disinhibition, uncontrollable laugh, and changes in perception, and there is a dreamlike state. Mental concentration will be difficult, and sometimes there is vasodilatation and associated tachycardia. The withdrawal state is only expressed in long-term heavy users. The major danger associated with the marijuana use is impairment of reflexes as well as judgment, and these effects they are usually exaggerated by the concomitant administration of other CNS depressants like barbiturates, benzodiazepines, and ethanol. These cannabinoids have certain therapeutic benefits also. They have the ability to reduce intraocular pressure, and as well as they have antiemetic actions. Due to their severe abuse liability, we are not commonly using this drug for therapeutic purposes. The next group of drugs with abuse potential is inhaled anesthetics. People use all these kind of volatile agent because they produces a sense of euphoria. And in this group, we have nitrous oxide, chloroform, and diethyl ether. The toxicity associated with the use of this agent includes loss of consciousness, impairment of the judgment, and this nitrous oxide in a pure form inhalation leads to asphyxia and death, and either is a highly inflammable agent. Moving on to organic nitrites, amyl nitrite, isobutyl nitrite, and other organic nitrites, they are referred to as poppers. Their major abuse indication is sexual intercourse enhancers, but the use is associated with hypotension, tachycardia, flushing, and methemoglobinemia. Steroids are the next agents. In many countries, anabolic steroids are controlled substances based on their potential for abuse. Mainly, this type of agents are used by bodybuilders because these anabolic steroids have the ability to increases the body mass as well as strength. However, its excessive use leads to behavioral, cardiovascular, and musculoskeletal adverse effects. Acne vulgaris and the premature closure of the epiphysis if it's used in children, and masculinization of the females, they were the anticipated androgenic adverse effects. And hepatic dysfunction has been reported in many cases, and there is increased risk of myocardial infarction. Increase in libido and increase in aggression, they are the behavioral manifestations associated with the use of anabolic steroids. Very rarely, yes, withdrawal syndrome has been reported along with the anabolic steroids, which is characterized by fatigue and depressive mood. And that's all about drug abuse and de-addiction. We have discussed few important drugs with abuse potential, their toxicity symptoms, and the management of their toxicity as well as their withdrawal symptoms. Thank you.